Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been performing cosmetic or aesthetic plastic surgery in the Scottsdale Paradise Valley area since 1992, and that's all I do. I just do cosmetic surgery. I do a lot of facial rejuvenation or facelifts, and a very important question that I'm asked is, Dr. Shapiro, what can I expect? What things can I expect after a facelift? What will it look like? How will I feel? And the best way to give you a general idea is to go through the common course of someone undergoing a facelift. So let's say we decide to do your surgery. You would come into the operating room the day of surgery. We give you some medication to help decrease the swelling. That's some steroids. You'll have the surgery, and post-operatively, almost always, I'd say 98% of the time, you'll go to the recovery room and then you'll go to the recovery care center overnight. Within that first night, we try to minimize any discomfort that you have. We try to decrease any of the chances of anything happening, like a hematoma or any wound issues. So after that first night, in the morning, I come in and I take out your drains. There are a couple of drains that go beneath the skin of the scalp to evacuate any fluid. After that, you'll go ahead and have your hair washed and go home. And within that first 3 to 5 to 7 days, you'd expect pretty regular things. The first thing is that you'll have swelling that will peak out at about 3 days and then start to minimize over time. You'll also have some stitches that are usually along the inside of the ear, the sideburn, and the scalp. Whether or not you have your brow done, you'll have some sutures up behind the hairline and possibly on the upper and lower eyes. Those stitches come out at about 7 days. Almost all of them come out at about 10 days. But bruising is something that we really need to talk about when you're asking about what to expect after surgery. So we really have to be on the same page about decreasing anything that can really give you increased likelihood of bruising, and that would be something like vitamin E, some of the common herbals, garlic, in terms of non-steroidal anti-inflammatory drugs, Motrin or Aleve. We want you to stop aspirin. We want you to stop a lot of things that commonly would cause bruising, and we give you a whole list of those that we want to avoid. If we can minimize the bruising and minimize the swelling, I think you'll feel like much better, much quicker. After surgery, it's very common, especially if we do laser resurfacing, that the new skin will be flaky and very sensitive. So we want to make sure you use liberal skin sunscreen. We also will have you use scar cream along the incisions after the sutures come out. But I think that after around 10 days to 2 weeks, I think you'll be feeling much, much better. You may have some fluctuating swelling. If you sleep on one side, you may find that it gets a little bit more swollen in the morning, but that really subsides by the 3rd week or so, at which time I think you're really looking good. But there's a real normal, regular process that happens after a facelift. You can expect it. You can talk to us about it before, so there are no surprises. Best way to figure out whether you're a candidate for facial rejuvenation is come in for a consultation. Thank you.